you can do the finger point test. If you really can't pinpoint where the pain is, then there's a good chance that that actually might be a heart attack. And you know, it's interesting because people think of chest pain, which is commonly, you know, the classic symptom of a heart attack, is the way that somebody would describe it. But actually it turns out that people that have had a heart attack describe it as a pressure or heaviness. I feel like I have an elephant sitting on my chest, squeezing sensation. And in fact, the very first heart attack that I ever saw was in the real world was my father's. And he described it to me, Lori, I feel like I have a vice on my chest. So I will never forget that symptom. It's very important that people recognize that.
The finger test, I want you all to remember this. If you can put your finger on the pain, it's probably not a heart attack.
Right, and it usually will typically last longer than a minute, too. It's not a fleeting symptom when you're having a heart attack.
Right, look at this next sign.
You're tired. You're juggling work, long hours, and the kids. You're stressed, but lately your exhaustion feels overwhelming. You feel like you can barely get out of bed, and it's been lasting for days. So, are you just exhausted, or did you just have a heart attack?
Fatigue is also pretty common. So, we have a lot of folks flooding the hospitals. When should you be worried about the fatigue enough to warrant going to visit somebody?
Right, well, this isn't just sort of standard low energy that we might feel because we've been working long hours. This is something really different. As the tape pointed out, you know, I've had patients say to me, I just literally couldn't get out of bed. It was a real sense of overwhelming exhaustion. But I do want to point out here, Mehmet, that when we look at patients who've been hospitalized with a heart attack and we ask them to look back in time, were there any hints? 80% of patients actually say they felt fatigue, and it was building up for 3 to 6 months prior to that overwhelming symptom. So I really want to remind everybody to pay attention to those warning signs because Mother Nature will sometimes give us little hints along the way.
Whisper to us, absolutely.
Right.
All right, take a look at this sign.
You're short of breath, feeling winded all the time. You know you don't exercise enough, and it may be catching up with you. You sit down and try to relax, but you just can't seem to catch your breath. So, are you just short of breath because you're out of shape, or did you just have a heart attack?
It's maybe the most dangerous of all the signs. Describe the kind of shortness of breath that worries you.
Well, you know, I really get worried when patients tell me that they're short of breath when they're doing their normal daily activities. So they sort of fail that walk and talk test. You know, they can't talk. And also, they describe this symptom not as a painful type of breathing like you might experience with an asthma attack, but more, doctor, I just can't catch my breath.
So as we've gone through the key symptoms for you to all remember, we've told you how to treat them. We can save some lives. You just remember, take away these whispering clues your body's offering. Thank you as always. Up next, the things you need in your house to prepare for any emergency. Find out the top 5 things that I keep in my house. You want them in yours. That's next.
Tomorrow, breaking news. If you're using melatonin looking for your perfect night's sleep, watch this show before you take another pill.
Here's the problem. It's not a sleeping pill.
Is any amount safe?
That's 9 times the daily dosage. This just infuriates me. It doesn't make you angry.
Why are they putting this on the market? I thought it was safe.
Plus, forget everything you know about anti-aging, the myths making you look older. That's coming up tomorrow.